In this video, I will explain femur bone. Femur is longest and strongest bone in our body. It is bone of lower limb. Above it articulate with this acetabulum of hip bone and form hip joint. And distally it articulate with patella, tibia and fibula and form knee joint. This one is knee joint. It consists of three parts. This upper part and this one is its shaft and this last one is its lower end. Let us discuss all of its part one by one. This one is anterior view of right femur bone and this one is its posterior view. This upper end consists of a rounded head. This one is its head and two-thirds of this head articulate with acetabulum and form hip joint. This head consists of a shallow depression which is called as fovea capitis. This one is fovea capitis. This fovea capitis provide attachment to ligament of femur and also obturator artery. Follow this ligament and enter this fovea capitis and supply this head of femur. Infralateral to this head there is a neck. This one is neck. This neck connect this head with shaft and this neck is making an angle of 125 degree with long axis of this femur bone like this. Is making an angle of 125 degree. And upper end also consists of two bony prominences. These prominences are named as trochanters. This larger one is called as greater trochanter and this lesser one is called as lesser trochanter. Anteriorly, these trochanters are connected with each other by a sharp line which is called as intertrochanteric line, and posteriorly these trochanters are also connected with each other by a very sharp line which is called as intertrochanteric crest, and near to this crest there is a tubercle which is called as quadrate tubercle. Now let us discuss its lower end. Its lower end consists of two condyles which are named as medial condyle and lateral condyle, and this anterior surface of these condyle articulate with patella and take part in formation of knee joint. That's why this surface is named as patellar surface. But posteriorly these two condyles are separated from each other by a fossa which is called as intercondylar fossa, which is present between these two condyles. And above these two condyles there are two bony prominences which are named as medial epicondyle and lateral epicondyle according to its location. And posteriorly you can see there is a tubercle above this medial condyle. This tubercle is called as adductor tubercle. This adductor tubercle is continuous with this medial epicondyle. Now its shaft. Its shaft anteriorly is very smooth and convex, but posteriorly it consists of a ridge which is called as linea aspersa. This one is linea aspersa. This linea aspersa provide attachment to important muscle and intermuscular septa. This linea aspersa is diverged proximally and also distally. Distally, it consists of medial lip and lateral lip. Its medial lip is continuous with the line which is called as medial supracondylar line, and laterally it is continuous with the line which is called as lateral supracondylar line. And you can see its shaft is becoming broader as we are moving distally, and distally at the posterior surface it consists of a triangular surface which is present between these two supracondylar line. This triangular surface is called as popliteal surface, and proximally it consists of a tuberosity which is called as gluteal tuberosity. Now at the end let's discuss about its side determination. Its side determination is most easy task. You can easily recognize its upper end from this head, and lower end is expanded and consisting of two condyles, and its head is directed medially. So the side which is continue with this, head will be its medial side and the opposite one will be its lateral side. And its anterior surface is very smooth and convex, but posteriorly it consists of linea aspersa. So from this series you can identify its posterior surface. And at the end, its anatomical position. Its anatomical position is also very easy. In its anatomical position, the head of the femur will be directed medially forward and upward, and this shaft will be directed downward and slightly medially in such a way that these two condyles, that the lower surface of these two condyles will be in the same horizontal plane. That's all about femur bone.